Picture the final match of the inter-house football tournament. A striker makes a run, gets tackled hard, and twists his ankle on the dusty pitch. He is down and in pain. In many community fields or rural schools, a doctor or nurse is not standing by on the sidelines. That is when emergency intervention steps in. Any action you take right now has three main goals, often called the 3 Ps: preserve life, prevent the injury from getting worse, and promote recovery. Knowing first aid gives you the exact steps to manage those critical golden minutes before professional medical help arrives. You stop being a helpless bystander and become the person who takes charge. To take charge safely, you must follow a strict starting point for any unconscious casualty, shown in this flowchart. It is a routine known as DRABC. Step 1 is D for danger. Look around to ensure the area is safe so you don't get hurt yourself. Next is R for response. You gently tap the person's shoulder and ask loudly, "Are you okay?" to see if they are conscious. If no response, move to A, airway. Tilt their head back to open the throat. Then B for breathing. Look at their chest to see if it is rising. Finally, C is for circulation, where you check for severe bleeding or prepare for chest compressions. You must stick exactly to this order. If you rush in to check breathing without checking for the danger first, like a busy road or a collapsing goalpost, you risk becoming a casualty yourself. Once the area is safe and the person is conscious, you can address specific injuries. If a classmate sprains an ankle, an older student might tell you to massage it vigorously with hot water. That is highly destructive. Massaging a fresh sprain increases internal bleeding and makes the swelling much worse. Instead, you apply the RICE method shown in this diagram. R stands for rest, meaning stop playing immediately. I is for ice. If your school does not have medical ice packs, you improvise. A clean cloth soaked in cold tap water works perfectly to stop swelling. C is compression. You wrap the joint firmly with a crepe bandage in a figure-of-8 pattern. E is elevation, raising the injured leg up on a chair above the level of the heart. While this method does not heal the torn ligament instantly, it stops blood from pooling in the area, minimizing the body's swelling response so the actual healing can begin. It holds essentials like cotton wool, antiseptic, and plasters. But before you touch a bleeding knee, which specific item in the kit must you put on first? Disposable gloves. They act as a mandatory barrier, protecting you from catching bloodborne infections like HIV, while also keeping the casualty's wound clean. There is a dangerous local myth that putting soil, cow dung, or crushed leaves on a cut will help it heal faster. Doing this introduces deadly tetanus bacteria straight into the bloodstream. You must only clean wounds with safe water and antiseptic. Managing an open wound correctly ensures you stop the immediate blood loss without setting the casualty up for a fatal secondary infection. Look at this outdoor assembly. It is 2 p.m., the sun is hot, and suddenly a student next to you collapses from heat and exhaustion. The most dangerous reaction bystanders have is pouring cold water on the victim's face or forcing them to drink. If you put fluid into an unconscious person's mouth, they risk severe choking. The correct protocol is to politely disperse the crowd to provide fresh air. Lay the person flat on their back, loosen any tight clothing like a school collar, and elevate their legs. Fainting is caused by a sudden drop in blood flow to the brain. By laying them flat and raising their legs, you use gravity to send that blood back to where it is needed. Imagine you are walking home along a dirt road and see a boda-boda accident. The rider is unconscious next to his loaded motorcycle. The panic around you will be intense, but your training takes over. You start strictly with D for danger, checking for oncoming traffic or spilled fuel before you step close enough to check their response. If the rider has deep scrapes, the infection control rules you learned for the football pitch apply here too. You put on gloves, and you never use dirt or leaves to stop the bleeding. Whether an accident occurs on a quiet school compound or a busy public road, the physiological rules of first aid remain constant. This graphic represents your complete mental toolkit. The DRABC routine keeps you safe while assessing an emergency. The RICE method manages joint trauma, and strict wound hygiene prevents infections. Accidents don't make appointments. They happen when we least expect them. The panic is a choice. By keeping these specific protocols in mind, you are fully equipped to step forward, stay calm, and potentially save a life in your community.